I don't see with this condition, but even them start. So the thing I don't know, say now waiting they worry that person be that. I call the reason I say waiting they worry this one now. It be like say now only this thing this person sabi. I say I don't know say you see my people this thing they very important. This topic now for everybody. No be for some certain set of people or people wey get special children. Now for everybody more understand this thing. As of last week we talk about the common learning disabilities wey we get. We even talk about the dyslexia, dyscalculia and dysgraphia and then the other ones. So is it possible may one person get all these things?
Yes.
Is it possible? May we hear from Dr. Yuji Kunta.
So, my people, like say today, I go get learning disability. I don't prepare for this English today. But I go rough and I go get it. Well, before I go respond to this question, I go want to a salute first for the organizers of this program. Because if you see the caption, saying ability
Inside
disability, I did very, very happy as Beautiful Hands Foundation, where they take collaborate with African Dyslexia Organization, and then this Dr. Fish radio Mukukong enlighten people about learning disability. So I want to raise salute to them before I start to the talk whether one person forget all these kind disabilities. Yes, one person forget. You talked about dyscalculia, you talked about dysgraphia, you mentioned dyspraxia, right? Auditory processing analysis, visual. Yes, if it happen for one person, yes. You don't ever see person where they blind and know they hear again. Is it possible? Yes. So one person forget all this kind of disabilities in one person. But then some people again that only one they forget. And now why me are they happy with the caption of this thing? Ability in disability. Because if you take understand all the ones, the different learning disabilities where we get, and then one person get one, it means say the other aspects in they do that.
Yes.
So people where they teach them, school teachers, if they understand that one, they no go they worry too much about the area where the person know plenty. But then go, yes, then go support them, but then go amplify the other areas where the person get ability. So there is no useless or no nonsense person for this one. So yes, one person will get all or more than one of the learning disabilities.
But if one person can't get this thing, make I ask you, are they very curious? If one person can't get this thing, waiting be the name. If you get all this thing, you get a particular name where the person, where how you will feel referred to that person. Maybe ask the therapist, Mr. Sam.
Yeah, as it be now, if one person gets all these conditions, you remember say on top this program, learning disabilities now we talk about. Now inside learning disabilities, all these conditions we don't list is still fall under the umbrella word when they call learning disabilities. So it still fall under the category of learning disabilities. And now why most recently they don't call a specific learning disability. So they no go just use the big word now say this person get learning disability. Then go direct after they don't screen this person now or don't do their own assessment and don't come diagnose and then go say okay this person get dyslexia, this person get dyscalculia. But if you get more than one, then go list out the different ones where you get. It just be like before you solve any problem. If you don't know what the problem be in the first place, you go just dey run around dey solve symptoms when you don't know the real matter. So now why first things first, you see pikin where you be like you get challenge, you refer am make you go do screening, diagnosis, make they know which specific learning disability that child get. Once we don't find out, then of course we will know how to help that child. So one person like Dr. Kunta talk figure more than one, and we will still call her learning disability.
We are still there on top Dr. Fish FM 90.1, and my name is Keswala Ditunji, and the program now Ability Inside Disability. Yes, and we dey talk about the conditions wey dey surround this learning disabilities, and we dey talk about dyslexia, dyscalculia, dysgraphia, and this rating and the auditory processing, visual processing, and other ones. So that the question wey I wan ask now, are there other conditions associated with these ones wey una don call?
As a matter of fact, you get plenty diseases, or let's say plenty developmental problem where they also they associated with difficulty for people where they try to learn something. Like one of the commonest one we'll talk in, which I believe say with time we'll still talk about that, namely autism spectrum disorder. People with autism spectrum disorder, then they always get some kind of funny behavior towards especially repetitive things about themselves. They want their team they well programmed and everything. People will get that disorder also will come down with some learning disability. You get what they call Tourette syndrome. Now that kind of disease also. Tourette syndrome is just people will just get one funny the first one like tick. Person if you just day, small boy if you just day, just they repeat one thing. We also they flip in shirt. Small thing you go repeat the same thing. You don't even know saying they wrong. But somehow the body don't they program to repeat most of those things. People with that very syndrome, then when they come down with serious learning disability. One if you look at other like the attention deficit hyperactivity disorder what I talked that time. Most of them difficult if somebody will not fit concentrate for say 5 minutes straight. How it is say one can learn. So you see that is a problem on your own self. Because when you need to concentrate to be able to get information with your teacher they tell you. But then because of that abnormality with them get to even sit down listing men and pass the information where if they feel store am for their brain, they feel use them subsequently, na problem. So one then they hyperactive, they don't fit sit down for one place, their attention span they very short. If they just 3 minutes they don't change. So those individuals also come down. Then for that other people like let's say you get bipolar disorder. Those ones are neuropsychiatric problem. Bipolar disorder, you see person they hyperactive today, tomorrow you see them they like saying they depressed. Those individuals said they always get problems with learning. Serious problem with learning. Because somebody get depression, you know, they always withdrawn. Things when they interested, you know, want to do them again. If it's too bad, if you go even want to see say in get commit suicide self. So in which majority of the suicide they get today that because of people where they depressed. So you see the bipolar disorder, depression / hyperactivity. These individuals learning, they always become problem for them. Serious problem. So there are numerous type of them. Plenty of them where they are associated with learning disabilities, but of utmost because we're thinking of much more children than adults. We're thinking of autism spectrum disorder, attention deficit hyperactivity disorder, Tourette syndrome, we're talking about bipolar disorder, and the rest of them. So these are some of those diseases where if person gets or some of those abnormal developmental problem where they get, they say them are then also they associated with. So these are the ones that we really call comorbidities. You get this particular problem, then you now come down with this learning disability. So these are some of the problems that are associated with them. So those are some of those commonest ones where most of these individuals they always experience. In which we believe it's not as if they are things that if they happen for a person, they'll just carry the person to them. Now something will make you even bring the person more closer. If you're able to discover, say, now waiting this person to get as a problem with that, I believe so you don't even have solved the problem for that person. So these are some of the association or some of the developmental problem with some these individuals they get with learning.
My people, we don't hear this thing. This thing they very serious, and as still they learn. Hope say una they learn something. And this bipolar we mentioned. I want to ask one question. This it gets stage where they show because some people be like say where they small, they no go know say they get, and then when they become adult, because I don't see someone we no know, we don't grow reach somewhere, then the thing can they show. So how that one can happen? Is he waiting? How that one take happen? Because me I don't understand. Person go dey normal, then later in life you go come discover say you get that bipolar.
Yeah, most times some of those illnesses or some of those developmental problems what they have for. Most times, yes, if you get maybe a predisposition, something where they link you towards say you feel tilt towards that direction.
Okay.
But certain environmental factors, now go just push you. Like now, okay, let's say maybe I know in my head I didn't know man at that time T. Then maybe one serious stress can happen.